Welcome to the Chapter 18 lecture about the economics of the welfare state. In this chapter, we will discuss poverty, income inequality, healthcare, and public policy, as well as political differences about the welfare state. Poverty, inequality, and public policy. The welfare state is the collection of government programs designed to alleviate economic hardship. A government transfer is a government payment to an individual or to families that provides financial aid to the poor, assistance to unemployed workers, guaranteed income for the elderly, and assistance in paying medical bills for those with large health care expenses. The logic of the welfare state. One major rationale for the welfare state is alleviating income inequality. A poverty program is a government program designed to aid the poor. The second major rationale for the welfare state is alleviating economic insecurity. A social insurance program is a government program designed to provide protection against unpredictable financial distress. These two rationales for the welfare state are closely related to the ability to pay principle from Chapter 7. The ability to pay principle was used to justify progressive taxation. The ability to pay principle says that people with low incomes, for whom an additional dollar makes a big difference to their economic well-being, should pay a smaller fraction of their income in taxes than people with higher incomes, for whom an additional dollar makes much less difference. The same principle suggests that those with very low incomes should actually get money back from the tax system. The problem of poverty. The poverty threshold is the annual income below which a family is officially considered poor. The poverty rate is the percentage of the population with incomes below the poverty threshold. The following graph shows the U.S. poverty rate since 1959. The poverty rate is much lower today compared to the 1960s. However, the trend has been increasing in recent years. Who are the poor? In 2009, about 43.6 million Americans were in poverty, 14.5% of the population, or about 1 in 7 persons. About 1/3 of the poor were African American, and a roughly equal number were Hispanic. Within these two groups, poverty rates were well above the national average, 25.8% of African Americans and 25.3% of Hispanics. But there was also widespread poverty among non-Hispanic whites who made up more than half of the ranks of the poor. Adults who work full-time are very unlikely to be poor. Only 2.7% of full-time workers were poor in 2009. Adults who worked part-time or not at all during the year made up most of the poor in 2009. Female-headed families with no husband present had a very high poverty rate, 29.9%. Married couples were much less likely to be poor, with a poverty rate of only 5.8%. Still, about 40% of poor families were married couples. What causes poverty? The major causes of poverty include lack of education, lack of proficiency in English, racial and gender discrimination, and lastly, plain old bad luck. The consequences of poverty include lack of access to health care, lack of access to affordable housing, and learning disabilities. Children raised in severe poverty tend to suffer from lifelong learning disabilities. Poverty is self-perpetuating. The children of the poor start at such a disadvantage relative to other Americans that it is very hard for them to achieve a better life. Income inequality. Mean household income is the average income across all households. Median household income is the income of the households lying at the exact middle of the income distribution. As you can see in the table above, the mean income in 2010 was $67,530, while the median income was $49,445. Income in the United States is quite unequally distributed. The average income of the poorest fifth of families is less than 25% of the average income of families in the middle. The richest fifth have an average income more than 3 times that of families in the middle. The incomes of the richest fifth of the population are on average about 15 times as high as those of the poorest fifth. The distribution of income in America has become more unequal since 1980. The Gini coefficient is a number that summarizes a country's level of income inequality based on how unequal income is distributed among quintiles. The highest level of income inequality are found in Africa and Latin America. The most equal distributions of income are in Europe, especially in Scandinavia. Compared to other wealthy countries, the United States, with a Gini coefficient of 0.410 in 2010, has unusually high inequality. Trends in U.S. income inequality. Panel A compares the rates of income growth for quintiles over 2 periods since World War II. In the earlier period, incomes grew at about the same rate for all quintiles, so the distribution of income was more or less stable. Since 1980, however, income has grown much more rapidly at the top than in the middle or at the bottom, so inequality has increased. Panel B shows the income share going to the richest 10% of the population since 1917. This shows a sharp fall in inequality between the 1930s and the late 1940s, the Great Compression, and a rise in inequality since 1980. The U.S. welfare state. A means-tested program is a program available only to individuals or families whose incomes fall below a certain level. Social Security, the largest program in the U.S. welfare state, is a non-means-tested program that provides retirement income for the elderly. It provides a significant share of the income of most elderly Americans. Unemployment insurance is also a key social insurance program. An in-kind benefit is a benefit given in the form of goods and services. A negative income tax is a program that supplements the income of low-income working families. The economics of healthcare. Health insurance satisfies an important need because expensive medical treatment is unaffordable for most families. Under private health insurance, each member of a large pool of individuals pays a fixed amount to a private company that agrees to pay most of the medical expenses for the pool's members. Healthcare in other countries. The United States differs from other wealthy countries in its heavy dependence on private health insurance and its high healthcare spending per person. Compared to other wealthy countries, the U.S. system has much higher costs. The higher costs do not necessarily imply better care. Some countries, such as Canada, have a single-payer system. A single-payer system is a healthcare system in which government is the principal payer of medical bills funded through taxes. U.S. healthcare spending as a percentage of GDP, a measure of total income, has tripled since 1965. Similar trends can be seen in other countries. Most analysts believe that the main force behind this trend is medical progress. We spend more on health care because more medical problems are treatable. This is the end of the Chapter 18 lecture. If you have any questions about this material, please post a question in the Ask Professor Pakula discussion board or send me an email.